We are about to enter our last panel of the day. Welcome our guests to the first panel. Hi, Aviva. Hi, Francis. And we are just waiting for council member, put her on gallery view. I think we'll just wait a minute.
I'll add her on as soon as she pops in.
Okay, fantastic. So I guess we'll start, and then council member Menin can join us when she has a moment. So this panel is about empowering parents to fight back. And we started this panel because we were contacted by parents from communities around the country. In fact, when we launched our website 5 years ago, one of the first parent to reach out to us was concerned about a gas station down the street that was selling to her son. So this is something that has been top of mind for parents. They wanted to stop the availability of these products. Hi, Julie. How are you? I'm just introducing.
Hi, everyone. Sorry, I was on. I don't know why I wasn't.
No worries.
I heard.
Literally 30 seconds we started.
Okay, good. Good.
Yeah. I was just saying we came up with this panel, this program. It's called Poison. Parents opposing illegal sales of nicotine. And it's a way for parents to take action and report stores to whatever reporting platform their community has. And it allows parents to highlight the need for enforcement. So here in New York City and New York State, we've had a vibrant poison program. We were very involved, Parents Against Vaping, in advocating for the passage of the laws, and I say plural laws because we work both with the city and with the state to end the sale of flavored e-cigarette products. And yet, almost 4 years later, these illegal nicotine vapes are still allowed, are still being sold. They're not allowed, but they're still being sold on almost every street corner in New York City. So we've joined forces with the City Council, with the Department of Health, with parents, and we are making a difference. So I'm proud to present our panel and our speakers. So I will start with New York City Council member Julie Menin. Julie is an attorney and a civic leader with over 2 decades of experience in the public and private sectors. She was previously the city census director and has also served as the commissioner for the Department of Consumer Affairs, among many, many other things. Again, her bio will be on our website and you can see everything that she's done. I'd also like to introduce Aviva Grasso, who is the tobacco policy manager with the New York City Department of Health and Mental Hygiene, and we have worked very closely with Aviva for many years. And finally, but certainly not least, Frances Daniels. She is a mom and she's a PAVe volunteer who is very active in our Poison Initiative in New York and will give us the parent perspective. So welcome, everyone. Thank you for being here. I wanted to start with Councilmember Menin, if I could, and just talk about the e-cigarette ban that we have in New York City and also in New York State. You know, it's been around for a while. COVID kind of made things a little more complicated, but why do you think that these products are still being sold in so many stores around the city? And what have you done in your capacity as a council member to try to affect this?
Well, first of all, Dorian, thank you so much to Parents Against Vaping for having me at this conference. I have to tell you, it's a real honor to be here. I'm here obviously in my capacity as a city council member, but I'm also a mom of 4 and care deeply about these issues. So I want to thank all of you for the great work that you're doing. So yes, you mentioned that New York City has a ban. We do have this ban on e-cigarettes that are being sold to anyone under 21. Businesses that are in violation are fined $1,000 for first time, $2,000 for subsequent violations. But as you point out, we are all seeing these products proliferate across New York City. Right now, we have over 2,000 unlicensed smoke shops, and many of these smoke shops are selling products that are targeted to minors. In my previous capacity as the commissioner of the Department of Consumer Affairs, back in 2015, I led the charge against synthetic marijuana and K2 and cracked down on that in a number of different ways. We need to employ those same strategies. We need to be doing more public awareness that these products are adulterated. They contain chemicals that are harmful for our children. We need to get the word out there. And so that is one of the things I've got a bill that would mandate the Department of Health has to do a public awareness campaign. But you also asked, so what is the city council doing? We're doing a number of different things, but one thing that we do is we can crack down on these stores. Many people don't know New York City has a sheriff, so we work with the sheriff's office. We, first of all, make sure that these stores are getting cited for violations. They can be padlocked. We can shut them down. It's a very lengthy, laborious process, but I have shut down a number of these stores in my district. And I want to say these stores are completely deceptive. I have a 5-year-old daughter, and I was walking by one of them recently. It's called Sweet Tooth. And my daughter says, "Oh, look, Mom, it's a new candy store." No, this is not a new candy store. And we have to be incredibly aggressive about cracking down on them.
Yeah, no, that's very true. You mentioned the Department of Health, and I know this is also, this is a problem that Aviva cares greatly about, and we've worked very closely with Aviva on this. The Department of Health has done everything they can, but what is your view about the easy access of these products? And when we discuss these products, we're really discussing flavors, because it's the flavors that have been the law ended the sale of these flavors on the city level and also on the state level. And obviously under 21, you're not allowed to buy any tobacco products. And yet, as Councilmember Menin said, there are so many unlicensed stores that are selling not only flavors, but also to children. So, the current enforcement is not working. So what do you think your agency can do? And I'll just add one more part to that question is, how can parents help you in that?
So, I mean, it's a good question. Unfortunately, from the health department perspective, there's not a ton that our agency can do, because the stores that are licensed, as Councilmember Menin said, by the Department of Consumer and Worker Protection, which used to be the Department of Consumer Affairs. And so the licenses are granted by them, and they are the ones who along with the sheriff's office, are the ones who are responsible for enforcing the existing laws. I think the other thing, though, is to take a step back to what Representative Wasserman Schultz said, which is that really we need more federal support with this. The agency that really has the authority to do something about the supply of products, which stores continue to sell because they make money selling them, is the FDA. And so I think that, we really need that federal support to really stem the tide of these products. The FDA has not authorized the marketing of these products, has denied marketing authorization for some of these products, and yet they continue to be imported and they continue to be distributed. I think one of the other things that I would point out is that tobacco and e-cigarettes in New York City are regulated somewhat differently. And so whereas when flavored tobacco products were prohibited, that could sort of be addressed at the distributor level by saying you will not distribute flavored tobacco products to retailers in New York City. There's no authority over distributors of e-cigarettes. And so it makes things even more complicated, so that stores can just buy it from wherever they want, and there isn't that level of authorization. But the other thing that I would say is that, the work that PAVe did for us last year really was very revealing, finding that 88% of the stores that were selling flavored e-cigarettes were not licensed. So it really is an issue of mostly the unlicensed stores selling these products, which are so harmful to our kids. And figuring out how that, as Councilmember Menin said, it's a long and laborious process to shut one of those stores. And it is something that I know DCWP is working on, but it's not going to be quick.
Right. Now, you mentioned the data that our program revealed, and that data is being used by the mayor and, and his offices in order to go after some of the distributors of these products, and to really, highlight this issue. We've met with the sheriff many times. Councilmember Menin mentioned the sheriff, and, he pointed out that many of these products, as we discussed with FDA Commissioner Brian King, CTP Director Brian King, many of these products are pouring in from China, into our ports. And there's really, we need border control. We need a lot more enforcement. Francis, as a parent, why did you get involved with poison? And, why did you feel that it was so important? You were one of our most active parent volunteers. And I know this is something that's really important for you. Oop, you're muted, Francis.
My apologies. I got involved with poison shortly after I discovered PAVe. And the reason for discovering PAVe was through a personal experience with my youngest child, who was hospitalized a year and a half ago for EVALI, which I know has been talked about in the conference today. They were hospitalized for 5 weeks. It was a very critical, life-threatening experience. And the good news is that ended on a happy note. But as a result of Finn's diagnosis and experience and trauma, I was eager to, make sense of all this and understand it. And as Meredith used earlier, understand what this hot mess was, because it just blew me away. So PAVe had just started their poison project, and I was able to get in and just say, okay, I'm ready to help. And it was great because it was field work. We were out on the streets walking, and the area that I worked in particular was the East Village. And we went out for 2 to 3 hour timeframes and went in and out of vape shops, recording data.
Mm-hmm.
And I can tell you more, but that's how I got involved. This through a very, very personal experience.
Right. No, I think that's very important. I mean, I think that we all see these stores, and I think one of the things that these store owners count on is the confusion that's out there. No one realizes, marijuana has been legalized in New York State, but many people don't realize that many of these stores are actually not operating with a legal license. Council member, I know that you've had several hearings on this fact now. And you've had lots of ways that you're addressing this enforcement issue. I know that this city is suing the distributors. You've talked about going after the landlords, increasing fines, even cross-department cooperation, which is becoming so amazing these days. So if you could tell us a little bit about all of that, that would be really great.
Absolutely. So the council passed a bill that was sponsored by our health committee chair, Council Member Lynn Shulman. I was a proud co-sponsor of it, that basically penalizes landlords that rent to these unlicensed smoke shops. It's $5,000 for the first violation, $10,000 for the second, because we really needed to think holistically, how is it that we can try to stop the proliferation of these smoke shops, and getting them in terms of the landlords directly seemed like a very good idea. And so that law has already passed and is now going to be going into effect. So I look forward to seeing the results of that. But the other thing that we're focused on, I mentioned earlier, I've got a bill on the public awareness that would mandate that the Department of Health and the Department of Consumer and Worker Protection, my old agency, would need to do a public awareness campaign. I just want to spend a minute on this. When we had the K2 synthetic marijuana epidemic, when I was Commissioner of Consumer Affairs, we did, I think, an incredibly effective job at basically eradicating that problem at that time. We spent $1 million on a public awareness campaign with bus ads and subway ads that made clear that K2 is not marijuana. You had a lot of young people who were purchasing K2 thinking that they were purchasing marijuana. We made the case, no, this is not pot. This is something that is adulterated. This can cause seizures. This can really hurt you. We also sent letters to all of the licensed cigarette dealers in the city of New York, warning them of the fines they would face if they were to sell K2. And then we really went door by door by door. I mean, we did a whole campaign around that. That's the type of effort that we need right now. We need to use every tool in our toolbox to fight this plague of these unlicensed smoke shops. And they are 100% undercutting the legitimate registered, licensed marijuana stores that exist in New York City. So they're not happy about it
Right.
either. It completely undercuts their business. And so we really need to make sure that people understand what is being sold at these unlicensed stores is an unadulterated product.
Absolutely. And I think what's really important to mention is that in these unlicensed stores, next to illegal marijuana products, you are also being sold these illegal flavored vaping products. And people think because they're everywhere that they must be legal. I mean, how could they be out in the open if they're not? So I think, Aviva, that's one of the reasons why you wanted to have the data. And, you know, we created this program, Parents Opposing Illegal Sales of Nicotine, but we also created a Google reporting form that parents could just do on their phone. Like they could just hold their phone up and they could just, whether they were in the store or outside of the store. And I think that's a problem for parents in the sense that they don't know how to report. You know, if we created the Google, but then, you know, we had someone who would go in and enter the data. So I think it's important that you needed the data, but how would you encourage parents or just people on the street to report these things? And do you think that the reporting forms, I know that they're being updated, but can you speak a little bit about on that?
Sure. I mean, I think, as you said, reporting is incredibly important, and laws are only as good as their enforcement. And so I think the reporting form that you had provided a simple, straightforward way of doing something because you knew that they were going in looking for that one product. In the city as a whole, we have a pretty good system through 311 where people can report sales of unlicensed sales. They can report flavored product sales, and they can report that both for tobacco and for e-cigarettes. And those reports then go to the agencies that are responsible for enforcing those laws. So I actually dug into a little data. I didn't have time to see if your exact reports were followed up by DCWP, but I did look at the number of citations for unlicensed sales of e-cigarettes, which was almost over 1,000, and just under 2,000 from January to July of this year. And then the number of citations for sales of flavored e-cigarettes, which was almost 2,000 between January and July of just this year. Those numbers are on track to be far higher than last year's numbers. And 2022's numbers for those citations were like double 2021. So this is clearly something that the agency is trying to invest in and is paying attention to. But I think that more people do need to be aware that 311 is an option. I was thinking about what Councilmember Menin said about undercutting legitimate businesses. And we do have a program where we send people out to do education with licensed tobacco and e-cigarette retailers. And they often tell us about the unlicensed guy across the street and the unlicensed guy down the block, because it is cutting into their business. So one of the things that we're actually looking at right now at our office is making sure that we can give them easy instructions for how they can report the unlicensed businesses in the neighborhood, because they know who has a license, they know what licenses are available, and
Right.
they have even, they have a different incentive than the incentive that parents have. But so 311 is an option for people who are in New York City. Go to 311 online, call 311, you can report those things. But the FDA also now has a system for reporting unauthorized products. And every single flavored e-cigarette that you see in a store is unauthorized. The FDA has not authorized a single one. So that's also an option for people all around the country to report them directly to the FDA. And maybe if they have a flood of reports from parents all around the country, that will help them to be able to do more about it.
Absolutely. That's something that was actually brought up in our discussion with Dr. King. There's a violation portal. Someone on the Q&A has asked, how would you know in New York if a store is licensed or unlicensed? And I assume that the 311 website would have that information.
I think you can't actually find that on 311, but you can find it on open data. So
Okay.
there's, if you just Google NYC open data, there's within that mass of data available from the city, there are lists of licensed retailers. The other way you can tell is if it's an e-cigarette retailer that has opened in the past 2 years, it doesn't have a license because there were no new licenses available. So if something opened last week in your neighborhood as a vaping product dealer, it does not have a license.
Sorry,
yes.
Julie.
No, I was just going to interject a couple things on that. In terms of legal cannabis dealer, it will be very clear that they are legal from the signage on there. And by the way, there's only a handful right now that have been authorized so far in New York City. There will be more to come, but there haven't been that many licenses that have been distributed. I also just wanted to mention 311. It is imperative to call 311 if you're in New York City. And the reason why is one of the functions of the city council is to have oversight over city agencies. So we have oversight over every city agency. We plow through that 311 data to be able to really analyze agency responsiveness. And so it's incredibly important. Also, if anyone who lives on the east side of Manhattan and contacts my office, we're always happy to go out to a store to investigate and then to work with the sheriff's office and the Department of Consumer Affairs if there are violations.
That would be great. Yeah. I think that, reporting a store is so important. Francis, in your neighborhood, what have you seen, the proliferation of these stores? Has it changed the character of your neighborhood? And do you think that your child would have, if there had been more education like the city council is proposing, which is so essential? I can't even emphasize how essential it is to talk about the damaging effects of these products on the developing adolescent brain, and talking to parents about how to talk to their kids. But do you think it would have made a difference for your child? And what's going on in your neighborhood now? Is it getting better? Is it getting worse?
Well, frankly, I haven't been there that long, but I will tell you, just the short amount of time that I've been there, I am seeing a lot of the old kind of crusty stores, which I've been there forever, smoke shops, vape shops. But I feel like every month I come across either a renovated or sparkly, sexy new smoke shop that is well lit, bright lights, big city, clean, not janky, but inviting and misleading about.
Beautiful.
They're beautiful. And so I'm seeing more of those. And that would be my one observation just around where I live is the shiny, sparkly new smoke shops in a time where we're hoping to not see new businesses of this kind opening up.
Right. No, it's so true. Another question that just came in to the Q&A, which is actually a really important question, is what happens when a store is reported, and how long does it take for the store to be, investigated? And, and I'm adding to this question, we know that these stores are not shut down. We know that the fines are very low, which is why council members' bill to fine the landlords is so essential. But in general, how long do you estimate it is for these 311 reports to be followed up on?
Well, I'm happy to start and then turn it over to Aviva as someone who, was within the agency that, is working with consumer affairs. So obviously the Department of Consumer Affairs and Worker Protection has responsibility here, but it can take a very, very long time. I mentioned the sheriff's office as that is really one of my first calls. Once we find a store that has violations, we let the sheriff's office know that we have them go and inspect. We let the Department of Consumer and Worker Protection know. They send out an inspector. This does take some time. Then we stay on them and make sure that there are violations. And it is a laborious process. It's not a great system. We need, honestly, better enforcement mechanisms to be able to crack down on these unlicensed stores. And we honestly need the state to designate more authority to the city to be able to crack down. That's really one of the main issues we have here. I don't mean to over lawyer this, but we have a legal issue, which is the city does not have as many tools in the toolbox that we need legally to shut these stores down. And we do need the state to widen the city's enforcement capability here in this sphere.
Aviva?
I don't really have a lot to add to that. I think that, it does take a while. It's when people file complaints, DCWP does respond to them, but it takes multiple adjudicated violations before they can shut a store. So if, for example,
Right.
I've sent complaints sometimes and they've said, oh yeah, we were just at that place last month. If they were just there last month and they're still waiting for their oath hearing, they're not going to go back right now. They're going to wait till that one's been adjudicated and then they'll go back. If it's one that did have its hearing and they're planning to go back eventually, they will sort of move it up on the list due to the complaints. But still, it's, it takes a few months for each hearing, and then it takes multiple hearings before there will actually be the chance that they might shut it. So it does take a while. And we understand that that can be certainly frustrating, and it's frustrating. We have a store actually just down the block from the health department that we talk about all the time. That we're like, how is this possible? And it
Right.
just continues to operate. So it's hard.
Right.
It's a resource intensive process for.
Yeah, no, it is. And I think we have to remember that, we're talking about New York City. I mean, it's a big city. We have a lot of ground to cover, literally. I remember, when we were speaking with the sheriff, he said, well, everyone is entitled to their due process. And it's true. We live in America. Everyone's entitled to their due process. So that does keep things, it adds some time to the matter, if you will. And if we're taking other states and other cities, it's a whole different situation. We are getting a lot of questions about what do you do if you're in Ohio or in Oregon or different, that would take a whole other, we can still implement the same program. It's just a different reporting method. And, we can always, anyone in America can report to FDA, because I think that's really important. Francis, I wanted to ask you, as a parent, did it make you feel as if you were making a difference, or how did you feel? Very often parents will feel helpless and they'll say, what can I do? Our goal is not to, engage in enforcing, it's just to highlight. And sometimes it will make a parent feel as if, they're actually helping their child. They're taking a stand. So is there anything you can tell us about when you were going into the stores? How did it feel, or how did it feel when you were working with, some of our other volunteers and staff members?
I absolutely felt like it was making a difference because there was a clear reporting system and a clear goal. And it was not just, oh, let's go, wander the East Village and make note of smoke shops. It was very well organized, and each vape shop offered a new experience. Let me put it that way.
Right.
And it was informative for just as a human being, I'm living in New York, to understand, wow, how do these people operate? What is their, how did they receive us when we walked in? Some of them were a little suspicious. Some of them were, oh, we'll talk to you. Sure. What do you want to know? And we had all different kinds of strategies for getting information about what was sold there. So I felt that the experience was very engaging and informative, and felt good about it.
Yeah. Yeah. No, I think at the end of the day, especially if you're dealing with this issue, you really just want to make you want to feel that you can actually make a difference. I think everyone does. And I think, I think Julie, for instance, many years ago, that's why you became involved in politics, to make a difference. And I think, it's such an important thing to give someone the power to affect change. And, I think we're getting closer. It's a big city, as I said, and there are a lot of stores, and we were dealing with an epidemic for a very long time. We're still waiting for our new numbers, so we're not really sure, what's happening, but New York City is kind of literally an island unto itself. So I think there is hope for the future, and I think we're all working really hard to make a difference. Is there anything you would like to say, Aviva and Julie, as we kind of round it out and tell parents how they can take a stand and get involved, and what you would like to see?
Well, first of all, I really want to thank you, Dorian and Meredith and Parents Against Vaping, the whole leadership team. because you all saw an issue, you decided to tackle it, to get involved, and you've had phenomenal results. And that's what I tell people all the time. I've been involved in public service for over 20 years. I got involved, I never thought I'd run for office, but I got involved because I cared about a certain issue, and that's what I got involved in over 20 years ago. And so if this is something that you feel very strongly about, I urge everyone who's listening to this to please get involved, because civic activism really can make a difference. And so my office is always open. Please reach out to us at any time. Always interested in hearing new ideas to tackle these issues. And thank you so much for having me.
Thank you. Aviva?
I would echo the thanks for a great session and really a great day. I've been listening on and off all day long, and I've heard so many really interesting presentations and so many powerful stories. And I think that it really is a matter of it's going to take all of us to really make this happen. I think raising awareness is something that we can do as government agencies, and it's also something that communities can do among themselves. And there were a lot of questions in the Q&A of like, how do we find out about flavor bans in our place, or how do we find out about lists of licensed retailers where we live? And unfortunately, all of that varies from one town and city and state to another. But there are probably there are ways to find out, and there are probably PAVe has some insight into some of those things. So I guess stay engaged with PAVe and reach out to your own local government and try to connect with how you can get involved and how you can raise awareness of what you see in your community.
Right. No, I would agree. And Francis, do you have anything to close out with? What do you hope to do in the future? I mean, this problem is, we're all working hard together, but there's still more work to be done. So how do you feel about that?
A great question, because I was thinking as the others were speaking that having raised children both in San Francisco and in New York, I am so inspired by what PAVe has done, and would love to see, PAVe happening in other major cities around the country. I know that's like long-term thinking, but it's
Right.
A great model, and it should be duplicated.
Yeah, no, this is the Poison program. Parents opposing illegal sales of nicotine can be applied in any city or in any state. If there are any public health departments of health, any cities or state organizations that want to work with us, we can definitely put this program in any state, depending on what the local laws are. Parents Against Vaping e-cigarettes, we are around the country. We educate, we advocate. And, I'll make one last plug before we sign off, but, we're celebrating our 5th anniversary, and we've come a long way in 5 years. And I think, we have a lot more to do in the next 5 years. So anyone who wants to join us, come to our website. You will find all the information about the Poison program. And here is Meredith to say goodbye as well. And we are wrapping up our program for the day. So thank you for being, one of the closeouts. And here's Mimi as well. So thank you, everyone. And thank you, Francis. And thank you, Julie. And thank you, Aviva.
Thank you. Great day.
That was a great
Yep.
panel. Well, wow, what a day. I'm going to try to wrap it up pretty quickly and just say, like, we started with Dr. Brian King, director of the FDA Center for Tobacco Products, and he talked about the agency, quote, initiating an escalated series of actions, which we appreciate, but he also acknowledged that there is a lag between when the agency collects data and when they can take action. And he also warned us all not to become desensitized if youth vaping numbers continue on a downward trend, which of course we all pray for, because no tobacco product is safe for any child. Even one child is one child too many. We heard some really heart-wrenching, powerful stories directly from young adults about their struggles with addiction and how difficult it is to quit this kind of addiction. One of the many things stuck in my head, but Jackie in particular, who said, I wish I hadn't started vaping when I was younger, because I feel like I'm in an endless loop. This has a huge handle on my entire life. And then we went on to the colliding crises of the youth mental health crisis and the ongoing youth vaping crisis. And Dr. Howard Koplowitz of the Child Mind Institute explained to us that teens are more likely to get addicted to substances like nicotine, and it can be harder to quit, and stated quite clearly these issues are linked. And then we heard from a great panel that Mimi did with mental health specialists, again, talking about the link between these issues and how we can help kids to deal with that. There was so much. We heard from Mayor Coleman of Columbus, Ohio, which is a real model for how to get these flavor bans. We don't use that word. How to end the sale of all flavored tobacco products in a big metropolis. And he was incredibly passionate and personal on a great panel with Carol Magruder of the AATC-LC, talking about menthol and the industry's pernicious and very specifically racist predatory behavior with menthol cigarettes, and how, while we are awaiting the final menthol rule any day, hopefully from the federal government, they are already trying to subvert the regulations, and they are always 10 steps ahead, but we can't let that continue. Which leads us to the parent session, which was the bookend really of the kids session, where we heard also some really painful and powerful things, so people could understand just how the human voices behind the numbers. One of the parents said, "It feels like there's a stranger in my house. The vape wall went up and I can't tear it down." And we heard about vapes are trash and the horrible environmental harms that these products are doing, not just the disposables, which I think the number is something like 400,000 disposables are thrown away in this country every day. I'm not sure if I got that right because I'm a little tired now. I'm not sure we all are, but I think so. We heard about the importance of alternatives to suspension. You don't punish children for addiction. You partner together, families and schools, to help support them. Then we talked about cannabis. We do not take a position as an organization on the legalization of cannabis, but for the first time, we had real experts, both in the federal government and researchers, talking about the co-use and how we should approach that, which led perfectly into what we just heard from Dorian about Poison, our program that we hope to expand, which is Parents Opposing Illegal Sales of Nicotine, and the importance of parents' voices and civic action. I'm going to end with this quote wrap up by saying parents' voices matter. And now I'm going to hand it over to Mimi and then Dorian. And thanks to everyone for joining us today. Please, Mimi.
Thank you. Thanks, Meredith, for that recap. And so just a very quick but very important thank you to, I have to give some shout outs here today. First of all, I want to reiterate a big thanks to our sponsors, including Kaiser Permanente. Oh, lost my Kaiser Permanente, Truth Initiative, Tobacco Free Kids, American Heart Association, Tobacco Free Florida, ICAS, Child Mind Institute, Missouri Department of Health and Senior Services, American Cancer Society Cancer Action Network, American Lung Association, and Arizona Concerned About Smoking. So thank you all. And also a big thanks to our panelists, our expert panelists, our speakers and volunteers who participated, and a very, very special and huge thank you to our incredible team. Most importantly, Josh Brown and Austin Spence, who really worked tirelessly to put this together for us. So thank you all. And Meredith, please, for the wrap up.
No,
Well, I was just going to say, I was just going to say before we all go, I'm going to do another plug, which we did in the beginning, but this is our 5th anniversary, and we have done so much with the support of our public health partners, with the support of legislators, with the support of departments of health around the country, and with the support of parents. We are parents, we talk to parents, we train parents to talk to other parents. And as Meredith said earlier, this proves a proposition that parents' voices are essential in this fight. And we would invite everyone watching to go onto our website and to see a little bit about our programs, about our advocacy. And Mimi, Meredith, and I remain full-time volunteers in this fight. And we hope that you will consider supporting us financially so that we can continue to help families around the country. We have a QR code, which is not on the screen right now, but parentsagainstvaping.org/donate to support our work. And if anyone is interested in any of the programs we spoke about, the Poison program can be adapted for any city and state. Our educational work is around the country. We talk to parent groups, we talk to school groups. We don't talk with children, but we talk with all adults who work with children in Spanish, in English, and we've also done in ALS, in sign language, or ASL, excuse me, ASL, and any other language that is out there. Thank you so much. And I think if you missed any of the panels, they live on our website, and please just go onto our website and you can find all of the work we do.
Right. And we're going to have some additional information and panels that we'll be promoting, that we'll be putting on the conference website. And I just want to thank my partners, because this has been quite a journey over the last 5 years. And we're incredibly grateful. I'm incredibly grateful to my partners, and we're incredibly grateful to all of you who have really been so generous with your time, your guidance, your wisdom. So thank you to everyone.